We have with us our first speaker for this very interesting session on marketing, Dr. SHAIL VASAVADA. Now, he is a senior consultant at Raghudeep Eye Hospital at Ahmedabad and is a very dynamic surgeon and has a whole lot of present publications in peer-reviewed journals and many presentations, both nationally and internationally, and has won innumerable awards. He would tell us what is most important for all our practices. That is, internal conversions is the key. And let's hear from you, Dr. SHAIL.
Very good morning to everyone. Thank you, Chitra ma'am and the entire ARC team for creating such a webinar on such a necessary topic, but something which is quite often ignored. I think there are several aspects to practice management. First is when you're starting up, your first aim is to start developing your practice. Then the second phase comes of growth. And then the third phase of either expansion or in today's time, if you're practicing in a tier 1 or tier 2 city, to actually keep sustaining the practice that you have already created with the increasing competition coming from all around. So I think there is a lot of challenge as far as practice management goes in today's time. There is a significant improved basic standard of care across all specialties, including ophthalmology. So it's no longer the time of, say, 3 decades ago, where, say, about that. So I think there is definitely an improvement in the basic standard of care in all forms of practice, including ophthalmology. This leads to increased competition. And now you also have corporates who have unending spending capacity. So all of these factors actually lead to, sort of an insecurity that your practice needs something extra to push for more patients to come in. We also have the stress of investing in infrastructure. We have the stress of constantly investing in equipments, which keep coming every 6 months, and you almost feel that you are way behind, left behind if you don't have X, Y, or Z equipment. And there is also the stress of maintaining human resources. And amongst all of this, you almost forget how you need to practice, what science you need to follow, and so on and so forth. So why internal conversions are, I think, most important compared to all other forms of marketing. Each has its own place and each has its own role. I think internal conversions are extremely important for patients who are particularly in a single or an individual practice. And there is limited time for that one person or two persons to take care of so many things, including patients, surgeries, OPDs, academics, travel, so on and so forth. And there are limited resources, both in terms of the amount you can spend for marketing, as well as the amount of trained manpower or capable manpower who can help you out as far as marketing goes. Remember that most patients still, although the times are changing tremendously, most patients still trust us. And therefore, most of them have actually visited you because they have some reference of either a happy patient who has visited you in the clinic or has undergone surgery with you. And therefore, it is actually our duty, not just from marketing point of view, but otherwise to offer them the best options that you have for them. The fundamental expectation of any patient who enters the hospital is to feel important. And so 1 out of every 4 customers are, leave because they feel they are less attended. And dissatisfied patients are likely to tell 10 people about their bad experience in the hospital, compared to a satisfied patient is not going to tell 100 patients. It takes about 5 times more money to attract a new patient than to retain an existing patient or get his family members to come. 2 out of every 5 patients are willing to pay for a more better procedure if given an option. And 90% of the unsatisfied patients will not come back again to you, and they will not even tell you why they left you or they moved to another practice. So this was a survey done by amongst Indian patients by a marketing agency, which was, I think, also supported by a couple of multinational ophthalmic industry companies. And what they did found is that 7 out of 10 patients in India are willing to pay up to 50,000 for a cataract procedure. And only 2 out of 10 patients of such types are actually offered a premium procedure in their practice. And the preferred source of information regarding cataract and cataract surgery in our country is still from an eye doctor or an ophthalmic surgeon, and not from counselors or websites and other forms. So this was an eye opener, that majority of our patients still rely on us as their primary source of information. And the primary concern of people with more than 60 with cataracts is actually near vision rather than distance vision, which we always aim for 6/6. But in today's time, more patients are concerned about whether they can read nicely after cataract surgery. And compared to that, this golden opportunity, we have an extremely low rate of presbyopia correcting IOLs implanted. So this is just to highlight that if we actually look at our own patients and try and understand them, there is so much potential in the existing patients that if you can convert them, that itself will take care of most of your growth. Methods of internal conversion. I think the most important method is to educate your team members, because if your team members are not convinced about anything new that you are bringing up in your clinic, the confidence will not show when they talk about any procedure or any process to the patients who are coming. So whenever there is any new equipment, any new surgery, any new machine, just talk about them and educate your own staff members about them. Second is, when you talk, please be confident in your body language, particularly when there's a new procedure that has come up. So say, for example, you have recently moved to contour, or you have recently moved to femtoLASIK, or you have recently moved to flax. So be confident when you suggest flax, even to your first patient, that no, I think this is the best technology that I think I would suggest for you. And the most important part, which I found and I've learned the hard way, is that do not hesitate to recommend the best technique, even when you are likely to waive off your charges or give significant discounts. And this commonly occurs when you are operating your staff or your staff relatives or your own blood relatives or your own close friends, where you have to either charge them very less, or you feel, if I tell him flax with trifocal toric, he's my close friend, he'll have to spend so much out of his pocket. And then sometimes we try and, suggest that, I think you go for phaco with trifocal toric, that should be okay for your mom's cataract surgery. And this is something that is picked up unconsciously or subconsciously by your own staff members and your own counselors. So if you do manual phaco or microkeratome LASIK to your close ones, and then you offer femto, telling to others that that's the best procedure, it really doesn't work. And it reduces the confidence and motivation of your own staff members to counsel others. I think the second thing that is most important is that in today's time, it is not just the surgery that you are doing, because like I said, the basic standard of care is improved tremendously. People also want, when they visit a hospital, a sort of hospitality experience. So I think upgrading infrastructure is something that is very important in today's time. Aesthetically pleasing infrastructure is something that all of us must try to do. And this is the cornerstone of internal conversions. If the patient feels good and if he feels happy with your staff members, this is something that will help them to be retained in your practice. So have good services, do not compromise on these aspects, like a good administrator, a good counselor who can, be a bridge between the doctor and the patient relatives, a good coordinator and receptionist and floor assistant who would be smiling when the patient comes and greets them, and if required, a public relations officer of that kind. Because remember, an irritated family member or a family relatives are unlikely to be in a correct frame of mind. But even before they visit you inside your clinic, they're already so upset with someone talking to them rudely or not attending to them when they asked a couple of questions at the reception, that they are less receptive, and they've already made up that mind that we'll probably go to another hospital to take a second opinion. So try to create a system where you get the patient in the primary exam room. That may be just an optometrist doing the vision, not even refraction or anything. in the shortest period of time, so that they know at least that the process has started and they know that I'm here and they need to take care of me. And make sure that your staff be very polite. There will of course be patients who are very difficult to handle, difficult to tolerate, but try to maintain as much of patience as much as possible. And I think this is something that is neglected quite often in most of our clinics, is keeping the washrooms well maintained. And in today's time, patients actually judge your hospital or the cleanliness or the hygiene of your hospital with the way you maintain your washrooms. So if your washrooms are not maintained, they immediately get a psychological feeling this place is not a very hygienic place, so as to say, for surgery. Try to create a personalized care for at least the patients who are planning or who have opted to undergo surgery with you. So if that may even mean the counselor going out into the OPD and talking to them rather than having them wait outside until the next turn comes in the cabin to call them inside. And I think enough chair time is something which is a must, not just by the counselors but also by the doctors. And I understand that that may not be possible for a single surgeon in an extremely busy practice, but therefore I think it's a good idea to have a separate pre-operative examination clinic, which we have been following for almost a decade now, where this clinic is only for patients who have taken date for surgery in the next day or a day or two. So the consultant taking care of the pre-operative clinic is only going to be seeing those 5 or 10 patients, so they can give sufficient time. So we have a dedicated time slot and a dedicated team which is geared up only for this clinic, which is the most important clinic because they have decided that they want to undergo surgery with your team. And we also like to keep proformas where whoever has seen will tick and write that I've suggested this surgery, say flax with toric or flax with monofocal or flax with trifocal. And if anything has
Is it audible?
Say for example in the OCT, poor retina or epiretinal membrane, that means the counselor knows that it's because your retina is weak that the surgeon has not suggested a trifocal for you. Also highlight the importance of the accreditations that you have worked hard for. So the accreditations like the NABH, the ISO are something that you have worked hard for, and because you are following these certain kinds of processes, it's something that should be highlighted, which means that you're following certain safety criteria. Do not hesitate to highlight your team achievements. So keep a place in your clinic outside with, say, nicely kept places where you can highlight your awards, your achievements, the certificates, photographs, so on and so forth. That also helps to build up confidence amongst the patients sitting outside who have just come, say, for glasses checkup. But then if they talk to someone outside, and somebody asks them which is the best place for cataract surgery, they may think of recommending you. There are several brochures and other materials that are now readily available, and each company is going to provide you with a host of their own materials, their own brochures. I would suggest avoid company brochures because they sometimes tend to over promise and over glamorize everything. So although they may give you everything, we at our clinic make sure that we do not use a single company made brochure, and we actually customize the brochures to our clinic. So have relatable photos. Don't have foreigners in the photos of your brochures, because patients don't relate to patients playing golf. 90% of our patients don't play golf, and most of the brochures from foreign company of IOS will have golf playing and all those kinds of things. So have relatable pictures, and these brochures are something where inside you can also highlight your own activities. So although this brochure is made for cataract, we also highlight our social outreach activities in them. We also highlight about the other clinics that are present in our hospital, so on and so forth. So make your own customized brochures for each kind of procedure, and that helps you create your own brand. For example, we sort of label our clinic as the pro LASIK clinic, where we have we say, okay, we are pro safety, pro results, pro everything, pro technology. So that creates a good branding internally amongst your own staff, and the patients also appreciate that, rather than using straight company made brochures. There are other ways of highlighting your technology and things. Say, for example, in the waiting area, there are spaces where you can place standees or posters and such things. My preference, although, is not once again to use company made direct material, because they're likely to be biased for one over the other. Another important point of internal conversions is the way you make your file. So we tend to give a file to all patients, and this file you keep changing every year or two. So, for example, in our today's file highlights the amount of services that we provide, the years that we have been in practice as Raghudeep Eye Hospital, the list of consultants inside, what is NABH, why NABH, and the backside contains details regarding social activities, about Be Eye Healthy program, which we do for children, or the empanelments or other things that you may have. So even if the patient had come for glasses, he takes this file home, you put your glasses prescription in it, and say it keeps lying at the house, somebody else may see it and they may pick up that, yeah, maybe for this, if they are known for this, let me go there for a checkup or take a second opinion. Fourth is, of course, testimonials, and you can have them written, printed, put up on walls or on dashboards, or you can also have video testimonials where you have your post-op patients where you can which they can highlight. Also, an important role of making educational videos for patients, and this is not for putting on social media, but sharing with your patients who have, say, for example, planned for cataract surgery, have undergone counseling, but they're still not sure whether they want to go for, say, flax or phaco. So make your own educational videos in simple language. So we, for example, have made videos in English, Gujarati, Hindi, all three languages, trying to explain the procedure in simple layman terms, so that when the patient goes home and is still confused about what to do, what not to do, they can go through this video on their phone, on their WhatsApp, which we share to them, so that they can think about it again, that, yeah, I missed out on this point, but yeah, this is what they were trying to say when they were telling me that flax is better for X, Y, or Z reason. I think another important role is making the patient feel good, and value added services is something that we find useful. The most important in today's time is proper documentation, which means proper documents for your file, insurance, and an insurance coordinator. Because if patient has an happy experience post-operatively, say, for example, they had some rejection or some query, and they pass it on to your insurance coordinator, and they respond in a day or two and help them out in giving a good reply, and if the patient gets more reimbursement from their insurance, they'll always appreciate and remember that this hospital was not just interested in operating and getting the money for me, they were also concerned about the fact that I should get my worth from the insurance. Another thing that we practice in our practice is to give vouchers. Say, for example, if we find that we want our opticals is not doing well, say, for example, so we give optical gift vouchers to all patients undergoing cataract surgery, or for, say, any other reason, any other procedure that they are undergoing. Say you get a 10% off, or patients undergoing flax, we give them two vouchers for free consultation, which they can pass on to any of their relatives, so that they are motivated to come to our hospital again for a checkup. So similar such things are something, these are very little value added services, but quite often patients appreciate these small gestures more than some discount that you may give. Another important aspect for internal conversions for their relatives is post-operative care. So if the husband has undergone surgery today, we make sure that we call the one of our trained counselors calls them every evening, the patients who have undergone surgery in the morning, to make sure that they are fine. And if they have any queries or difficulties, they'll make sure they talk to one of the consultants, so that before the hospital closes down, all of their doubts are cleared. Because the most important reason for dissatisfaction next day is that, at 12 o'clock at night, I forgot and I wanted to ask whether I should do this or not, but nobody picked up the phone and I was confused, so on and so forth. So before going home, make sure all patients of surgery are well attended to. And we also make sure, which is now a part of NABH, that you call them after 5 days, 7 days to make sure everything is okay. So if you take personalized care even post-operatively, he will be more motivated to, ask his wife to undergo surgery here, or his brother or his other relatives to go, that they really do take care. And like I discussed, educating staff is not just a one-time procedure. Even if you have no new technology added, say for 1 year, every 3 months, 6 months, you must have continuous staff training and awareness. And if there's something you want to highlight it on that day. Say for example, there's a new equipment that you have bought which you want to highlight, that this is the newer or latest technology, OCT or biometer or something of that sort. So try and create a sort of small event that creates an importance to the new technology that you have added completely. And fifth is something that all of us are really concerned about, that to try and convert the patient, what should you do for pricing? Because patients now are very smart. They will pressure you that this X very prominent doctor is giving me the same lens for 10,000 less, or 5,000 more, or 3,000 less, or he never told me about flags, so why should I do this? So I think that this is somewhere where we have to draw a line, that do not compete for price, but compete for quality. So be very polite when you talk to them, when they say that, but this person is telling me this much, why are you charging so more? Just be polite. Yes, that is an excellent doctor and they have an excellent track record. Based on the things that we do or we prefer single use, the safety criteria that we follow, the infrastructure. This is something that we can offer you. And do not feel guilty in charging more than even, say, for example, a senior colleague who is practicing for several years. So if you feel your infrastructure, your equipments, your technology, and your effort for that case requires a certain amount, do not hesitate, even if that means you're charging 5,000 more than the very popular person just next to you. And do not try to justify why you are charging beyond a point certain amount, because you are not a salesman of an AC or a TV. You have your own, like lawyers can charge differently, similarly we can charge differently as well. So what has been our results having followed these principles of internal conversions rather than any other form of marketing? I think what we have found over the years is that word of mouth from happy, satisfied patients is the biggest way of converting more patients, or making sure that they bring more patients to your practice. One happy flax patient will bring more flax patients. So he will be proud. Some patients feel proud that I got a surgery done for 1 lakh. Oh, you got it just done for 30,000. Oh my God, you should go to this place. They do the best technology and they make sure that they give you the best results. And it's similar for femto LASIK, for Contura, for premium IOL, so on and so forth. So if you create and give that impression to the patient that this is the value that they are getting, they are likely to bring more similar category patients to you next time rather than lower category patients. And based on our own, following this strategy, we in our practice, we have more than 50% conversion to flax, which is increasing year on year. We have more than 50% conversion to Contura femto LASIK. We have stopped offering blade LASIK completely for the past 7 years. We've been able to maintain a stable surgical and OPD volume over the last 5 years, even over the period of transition, because that's a time when you are really worried, that you feel insecure that if I don't offer pricing advantage or something, my practice will go down because now X name is missing, or Y surgeon has left to another clinic, so on and so forth. So I feel if you can, in a tier 1, tier 2 city, if you can maintain your stable surgical OPD volume, that itself is quite an achievement to say. The also other advantage is that you become known as a non-advertising hospital, because now people sort of quite often many have a sort of negative impression that the hospitals, even otherwise, are extremely commercial, so on and so forth. So by avoiding any form of other advertisements, you sort of maintain the relative sanctity that patients tend to expect from hospitals. And in the end, do what you feel is best for the patient, and do not feel pressurized by what other practices and others are doing, because each practice is unique in its own way. and you have to fine tune your own marketing strategies based on the aim, the goal, and the way you practice. So thank you very much for the patient listening, and I'm sorry for the internet issues.
That was a wonderful talk, Dr. Shail. I'm sure all the expert panel would heartily agree. It was very well done and it covered all the salient parts of it, and you shared it so honestly and completely. And I think that was really very useful for us. So I think we need to discuss some other aspects of how to enhance surgical conversion, because what you said was so completely clear and distinct. So let me take this first question with Dr. Rohit Chetty. Dr. Rohit, we've heard an excellent talk from SHAIL now, but now when we are now talking only about internal conversions, we are not dwelling about the marketing, which SHAIL says is not necessary. We will come to that later. But to enhance the internal conversions, would you believe that you would evolve some kind of an incentive pattern to drive it further?
Thank you, ma'am, and thank you, SHAIL, for a very insightful presentation. I like the concept of internal conversion because we believe in it perfectly completely in sync with what you said. Because entire efforts of ours, even we see around close to 1,300 patients a day, everything depends on how you try to convert your patients you're coming for you from internal sources. The most important thing, 3 points I would like to add on what he said, is what makes us to convert is, one is how transparent you are. The more you create a shroud of cloud over your process, the more you try to keep trying to hide things from them, these people usually escape. The second is about how internally you keep analyzing yourself. It's not for your NABH, it's not for any other process. For example, we looked at, there are close to 13 touch points for a cataract patients coming to our hospital, because we do everything, including dietitians to diabetologists, everybody is in here. Because more you try to send them out, the more chance that they will never come back. So we evaluate how many patients were referred for XYZ procedures. When your practice increases, it's very important that you try to keep the flocks to yourself. So that is where I think it's very important to invest on. For example, we do also have a treadmill, echo, and a full-time cardiologist, because we felt that minute you refer the patient because of some changes, they never come back. So, I mean, it differs from institution to a practice, but I can only speak as an institutional way. But what I'm trying to say, even in private practice, there will be lot of these touch points which you might miss. This first is the transparency, to keep evaluating your touch points and how many touch points each of your procedures have, and where does the pilferage or changes happen. The third most important thing is to always be very flexible with your standard operating procedures, and not to be very rigid or try to say that you etched something in stone and you're not going to change it. So flexibility is most important when you're trying, because there are times that something which you've been doing for the last 25 years has been a total disaster, and then you have to relook at how it can be redone. So every 3 months we look at looking at our standard operating procedures, and every 3 months we keep changing to see if we can do it better and if something has worked well or not worked well. So transparency, flexibility, and trying to adapt to the scenarios are the 3 most important things I would like to bring here.
No, but you didn't. All your points were very valuable, and how to hold on to patients. And I think we should take tips from SHAIL and Dr. Rohit to keep enhancing those weak points in your individual practices. But to keep the internal conversions going, that my question was, would you incentivize all the employees in some way? No,
because the reason is we don't incentivize anybody, including doctors, and because one of the major factor of incentives for our doctors at the end of a year or the staff is how many people write about them in a Google. good about them. So we use a different measuring tape, not the measuring tape of how many they're converting. Because if a patient writes good, it also adds value to how they're performing. So we kept the incentives out of this in our practice.
Any of the other expert panel? Yes, Dr. Rohit.
I wanted to say
I
something.
think I fully agree with Dr. Rohit. Incentives, whenever they are given, ultimately they corrode your quality. Why I am saying they corrode your quality? The indications, the contraindications become relative indications. So in the long run of the institute, it is always not to give incentives. For a short term, you will find that there's a spike in the number of procedures which are being performed. But then there would be unindicated things which would also be coming about. This is the most important. At least we are not giving any incentive to anybody in our practice. That's the, no doctor, nobody, never. The second most important thing is that whenever a patient is coming to you, as Dr. SHAIL has said, he's coming to you because of your name, because of what you have stood for. So he's trusting you. So if he's trusting you, so you have to your main criteria of putting forth the treatment has to be based on the process, how you would treat your own family members, rather than giving indications for surgeries, telling that this should be performed. Would you get the same performed in your own eye under the same condition? So internal satisfaction, because he's coming to you because of trust. So the truth with transparency has to prevail.
Dr. Vandana,
Can I make a comment? Yeah, I would like to make a comment here. Yeah. Even though, I agree. And first of all, ma'am, thanks a lot for having us all here. It's a very important topic. And SHAIL has made a very, very comprehensive, very nice presentation. I agree with all the points that, Dr. Rohit as well as both the Dr. Rohits have made. However, I would like to play a devil's advocate here and also share sort of a diverging viewpoint. I think I agree that, when you incentivize certain staff who are critically involved, let's say in the conversion, then you're putting a wrong incentive in their mind as to the conversion. Now, we need to understand who are those people, whether those people are the doctors or those people are the counselors, or who are those people who are actually involved in the conversion. Actually, incentive can be actually structured in the right manner for the entire organization. Because as SHAIL mentioned, it's actually the whole organization which is involved in improving the conversions, right from the way the patient is greeted at the reception, the customer service, the operational efficiencies, the communication skills of your doctors, their results that they are delivering, and of course, finally, your counselors and post-operative, your OT staff and everybody, right? So I think if you are sharing, and if your organization is growing, and if you're sharing part of your growth with your staff, which is over and above what you are giving them as a payment, as their salary, I think that is fine, because that motivation that everybody is going to be part of it, not just the counselors or not just the doctors. And that does not bring wrong incentives where doctors have to unnecessarily prescribe procedures or unnecessary investigations, or counselors have to unnecessarily push the patients to increase conversions. That does not happen. Whereas at the same time, you are motivating and incentivizing everybody. So we, in our organization, we give a quarterly incentive to the whole organization, which is exactly the same. There is no difference in the in the incentive, the way they get it. Based on their salary structure, they get the incentive. It's not more or less for the counselors or for the reception staff. It just aligns everybody together is what I would say. Second point that I wanted to make was the which I think SHAIL touched upon, but I would like to emphasize, since we have experienced it ourselves a lot, is the training of the staff. Because your internal customer, which is your staff, is the actually most important customer. If you don't take care of your own internal staff, then your external customer, which is your patient, is not going to be taken care of well by your staff. Because we as doctors, we probably spend 5-10 minutes out of 1.5 hours that they're spending in the hospital. So training of the staff and critically analyzing your processes. A lot of times, if let's say some staff is not working properly, we are very quick to blame the staff that why you did not do this, why you did not do that, without actually critically analyzing the processes, that may be the inefficiencies in the process itself. So two things I would like to emphasize. One is critically analyzing the processes that how the organization is functioning and where there are issues which are creeping up because of which staff is not able to work properly. And second would be training of the staff, because training cannot be less emphasized. You train somebody once a year and you feel that you've already trained them, that's absolutely not sufficient. Because if your staff was as smart as you, then there was nothing like it, right? Then they would probably be sitting in your chair. And we all need to recognize that some of your staff is not going to be as smart and they'll require repetition multiple times. So training, building training and having it repeated after every quarter or every few months, I think is also essential.
Chitra, can I add something?
Sure.
I think I cannot agree more with
concise.
Vandana. Hello.
Let's all keep it very concise so that more.
Okay, I'll just summarize. I think SHAIL, beautiful presentation. Whatever you spoke, very close to my heart. That's the way we've been working. We are slowly growing. Vandana and me have had very in-depth sessions on some trips. We were back there and I could not agree more with her. I would just say that your staff is your best customer, underline apostrophe, because if your team is happy, there is no way your patients can be unhappy. So I think that one sentence is a punchline. Keep your team motivated, delighted, and happy, and they will keep your patients happy. So I think that is the carry-home message from what Vanna said. Am I right, Vanna?
Ramuti, would you want to
Absolutely,
add? Kumar,
Can I say something?
yes, Kumar.
So, Sahil, excellent presentation and all of your contributions by everyone else. I want to ask 4 questions to you. One is you give videos to your patients. So what is the percentage of patients that really see the video you gave and they say that it was useful? The second question is, if you put a multifocal, say for 1 lakh, and you put a trifocal for 1.5 lakhs and the neighbor is charging 1 lakh, my question here is, how do you justify the additional difference? Normally, the patients have a tendency to say that the lens cost is the same. I agree with you that you said that the lens is, we are not selling the lens. We are selling our technique, our technology, our experience, whatever it is. But how do you justify to a patient that if you are charging, say, 40,000 more for the same lens from your neighbor, what do you say? And my next question to you is that a patient who undergoes flax with you and goes and tells his neighbor that he paid 1 lakh, do you have some sense of fear sometimes? Because his neighbor's budget is only 35,000. And that budgeted patient will never come to your clinic because that other neighbor has already spent 1 lakh. And then they do not converse, yes, that your system is having a full range. Then do you have a thought process that only 1 lakh patients will come to you and the 35,000 patients will not come to you? And have you ever had a dropout? Like one patient has had 1 flax in one eye, then they come back and say, no, we would prefer to not have laser for the other eye. What is your analysis on that? Thanks.
So, sir, excellent questions. First is these videos that we have started giving are only recently over the last 6 months or so during the COVID time that we had this idea and we have started. So, very little, feedback as of now, but I don't think they may actually help in conversion, but it's just a value-added feature. Okay. The second aspect is absolutely correct that how do we justify? I think what we used to do initially was to try and justify in the fact, take pride that we used to give brochures that, we use single-use devices, importance of single-use, not repeating use, so on and so forth. Now, I typically tend to say that, this lens, you can get it done for free also at a trust hospital and somebody will charge 2 lakhs also for this. Each hospital, each practice has to devise their own way based on the infrastructure, the safety characteristics that we follow, the quality protocols that we follow, so that the risk factor is lowest for your eye, and therefore we decide our charges accordingly. I sort of tend to brush it off that I don't want to know what somebody else is charging more or less. It's everyone has their own way of deciding. These are our charges. So I generally try to avoid that talk by saying that, yes, of course, there'll be people charging even less than what you're quoting right now. I'm sure you'll find them. And the third thing is, yes, it's a double-edged sword doing more premium patients. And yes, that impression does go out that this place is only for the super rich because yahan to 1 lakh se kam mein kuch hota hi nahi hai. But then on the other hand, that impression has also helped us to increase our flax conversion so much that we are actually thriving on that. I think if that was not happening, with the volumes that we have, we would have probably be in degrowth in these last 4 or 5 years. But the improvement in the conversion to flags has actually helped us to sustain and grow in our financials over the last 5 years. So yes, it is a double-edged sword. You may lose out on some patients, but over the years now, most of the insurance reimbursements, quite a few, most of them get at least 50, 60, 70,000 as a reimbursement. So quite a lot of them are sort of willing to pay at least 20, 30, 40,000 extra if they get good quality treatment or to a known doctor or a known place. So that's the other aspect. Yeah.
Oh, yes, I do. I think we have to make it to our thoughts. I would want Ramuti's opinion and also an answer to this question. How far would you go in cutting costs to ensure conversions? Yes, Dr. Ramuti.
I think excellent talk, SHAIL, and very pertinent comments. All I have to say is that, some of the comments made by Vandana as well as Kamal. One thing is, Kamal, I completely agree. I take care of my staff and they take care of my patients. And that's what works well. As far as incentivization is concerned, especially when you have multiple centers and you want each one of them to be performing well, setting some kind of goals and targets, and when that is achieved, incentivizing the entire group is something which works very well. Obviously, you have to ensure that there is no compromise on ethics. Procedures or surgeries are not done when it is not indicated. That is something that you have to genetically put into the entire organization, and we are constantly striving to do that, and it works for us. But having said that, when as a team they have achieved a certain goal, they have achieved a certain target, appreciating them not just by words, but also giving them some kind of a monetary compensation does work in a positive manner. Of course, you have to make sure that it doesn't work negatively as far as ethics and quality is not compromised. And regarding giving cutting down on costs, I never do that, in the sense that we tell the patients that we have right from 0 to 1,62,000 is the cost of our cataract surgery, whether you come for a CAM surgery or whether you come for a LRCS with a trifocal toric intraocular lens. And sometimes when a patient gets into a conversation about reducing costs, more to just make them happy, you say that, okay, a couple of thousand rupees, not just me, but all our counselors or consultants are enabled to give that kind of a concession. They get into a greater conversation beyond that, then we tell them, yes, we have lower packages, you can go for that. That will also give you a good results. It's not necessary that you have to go for the highest package, because every patient of ours fills in a form where they tick off their experience in the hospital. One of them is the cost. And somebody who has got a multifocal done with LRCS ticks cost of the treatment high, we always tell them, they already know it. We tell them, yes, you could have chosen something which is less expensive. And we have had people from the same families, the neighborhood, where one person has gone for a more expensive procedure, another has gone for a less expensive procedure. But we say this is it's transparency, in the sense that they are made aware that these are our costs for the different procedures, and you opt for it, you pay the right kind of money for that, and they get value for it. So as far as they are made to realize that there is a value proposition for whatever they are paying, they are willing to go for it. And that's the reason we find that whether it's torics or LRCS are converting into femtosecond or SMILE, there is more and more uptake, not just in the tier 1 cities, but even in the tier 2, tier 3 cities. And that's something that's coming across ophthalmology per se. And most important factor I feel that SHAIL made was that, it's extremely important that you give your patients who walk into the clinic, they are your prized possessions. Give them and their attenders an experience that knocks their socks off. It is not just the 5 minutes that they spend under the operating microscope, but the entire process, cutting down on the timing, making it very comfortable for them, answering their queries, not just by the ophthalmologist, but the entire team. And as far as the team is convinced about what you're doing and all of you are working in sync, I think that translates into a successful practice.
Yes, thanks a lot. Rohit had raised his hand. While he expresses his query, I would also want him to answer this. Would you have any other suggestion for internal branding? SHAIL has already spoken enough on it, and I think we have dwelt on the first topic long enough. Very briefly, Dr. Rohit, besides expressing your query, what additional point I like to add for the internal branding?
The only one correction I had was I understood the incentives was for each person or something. But what I want to correct myself here is that exactly like Dr. Vandana said, we have an incentive from watchman to chairman if we reach a certain level of target. And so that, it's not that only one particular person gets or one particular department gets. So everybody feels motivated. That's the only correction I wanted to say. And whatever I had to say, I had already expressed it before when you asked me to do it.
Yes. And of course, internal branding to the best way possible is important. I think people will judge you from the pharmacy to the washroom to the optical, and everything has to be, if not classy, at least it has to be functional and as clean as you can manage it, because people are, while they're sitting outside, they're constantly forming impressions and opinions about you, and you need it to be as positive as possible. There could be a lot of discussions here. I think erroneously.
Let Anaga have a say. She already requested for it.
Yes, Anaga. Yes, Anaga. I'm so sorry, Anaga.
Thank you. Thank you, sir. Excellent presentations. Sir, all the panelists and experts, I would like to just ask one question. What is your idea of an ideal conversion rate? And how do you measure it? Because I know there are softwares that we all have, but because each patient can come back 2-3 times, and each time a different counselor would counsel. So then that becomes the catch. So I know the time is short, but if you can just briefly.
Can I take that? Because we are closely tracking that. We have a monthly review meeting for all centers, and we do have a benchmark for this, which we have developed over time. What we find is that a patient who has come and got a cataract has been identified to have cataract. Let's talk about cataract. In that case, the number of people getting worked up for the procedure is about 75%. In the sense that they have been, it's not just someone whom you say that you have cataract, come after 6 months, but advise strongly that you have cataract. We find that it's about 75%. And whenever that benchmark drops down, we tell the others that the particular center that this is dropping, you need to be performing better. And there is also a drop off from the conversion from workup to surgery. And we find that that is more in the range of about 90 to 95%. That's more often because of medical reasons or something, and many of these patients come back over time. That's the reason we track this conversion over a 4-month period. And this has been working for us. When it comes to refractive surgery, it's about 60%. When it comes to retinal surgeries and retinal injections, about 90-95%, because those are patients who really need the procedure, and most often they go ahead and get it.
Thank you.